I think next we will move on to our first speaker, and this will be the Impact Survey, an international collaborative research initiative for the OI community, and this will be presented by Samantha Prince from the UK.
Good morning. Thanks very much for the invite to be here to talk to you today about the Impact Survey, which is a collaborative effort sponsored by Mereo Biopharma, and the Impact Survey is all about living with OI and understanding the experiences based on community insight and evidence. My name's Samantha Prince, and I'm a consultant for a company called Wickenstones, and we help support new drugs and medicines to market, and part of that process is helping to generate data and evidence to outline unmet need in patients in various conditions. So we've had the pleasure of leading on the technical development of the Impact Survey. I know many of you probably will already be familiar or may even have taken part, but I hope I just spend a few minutes giving you a bit of an outline to the development of the survey and the participation, and it will set the scene nicely, hopefully, for the next talk by Lena, who's going to share with you some of the initial pain data that we've generated. So, thinking back, I know yesterday a lot of people talked about survey fatigue, and there's lots of surveys out there, and why we felt the need for another one. Well, our goal was to address some common goals between the OI and clinical community and industry. And what we were really hoping to do was to understand and describe the real impact of living with OI from a range of different perspectives. So from an OI community point of view, what we really wanted to do was to ensure the voice of people with OI is heard. Hearing from not just one set of individuals, but asking questions right across the community and hearing from people what sorts of things really do matter to them. We were hoping to raise awareness of the reality of living with OI and also the diversity of people with OI. Importantly, we also wanted to give people the opportunity to participate in the generation of evidence to support new medicines. From an industry perspective, a project such as this helps to bridge evidence gaps, and that's important to help decision makers understand the real value and need for treatments in a way that they'll understand. And of course, from a clinical point of view, we hope to raise awareness amongst healthcare professionals about the lived experience of OI from a patient perspective, and hopefully give them food for thought for optimizing future care and treatment for people. So looking back to the initiation of the survey, one of the key questions we had was, how do we know what we don't know? And what I mean by that is, if there are significant gaps in our understanding and knowledge, how do we know what they are? How do we know what questions to ask and who to ask them to? So in the context of this piece of work, the process for answering that looked a bit like this. So first step was to engage experts, and those experts are people with OI, people who are actively involved with the OI community, people with an academic interest, and also clinicians who treat people with OI and have daily interactions. So to that end, the project started off with the initiation of a steering committee, and I think that comprises around 10 individuals from around the globe, some of which are in this room. And those individuals are clinicians, experts, and representatives from OIFA and the OIF. And they've supported the project from initiation, providing some insights and all-important guidance to help us ask the right questions. Step 2 was to formulate some research questions, which we then tested by conducting a systematic literature review. And that involved looking at all of the OI literature out there to see whether or not there was existing evidence, existing knowledge to answer some of our research questions in full or in part. The next step off the back of the literature review was to then identify where the gaps were. And that's not always easy to do because we don't know where the gaps are, if they exist. So what we did was used the input of the steering committee to help us understand what was missing, what's important to ask, what's meaningful to people, and which of these gaps are the most important ones to include in a survey. And on top of that, which sorts of questions do we need to help support access to medicines? And then finally, was to develop a survey to try and address some of those questions that we'd identified. So we focused on 3 core topics: the clinical impact and patient journey, the humanistic impact, which all involves things like quality of life questions, worries and concerns, and we also looked at the economic impact, so direct and indirect healthcare costs, out-of-pocket costs for people looking to obtain the things they need to manage their OI. And the literature review revealed quite a significant amount of gaps in our knowledge. All sorts of things, this is just to name a few, things like understanding the wider health concerns beyond bone health, the transition of care from pediatric to adult healthcare settings, the impact of wider health concerns on quality of life, for example, and there were significant gaps on the economic impact, very little data out there at all. So we had to go through a process of prioritizing the gaps, looking at those things that were clinically relevant, things that were meaningful to the OI community, and also looking at those things where the largest gaps lay, and as I mentioned a minute ago, economic impact being one of them. So the results of the review was published earlier this year in the Orphanet Journal of Rare Diseases, and this is free access for anyone who's interested in learning a little bit more. Please do come and grab me. I can provide a link for anyone who's interested. So what did we ask in the survey? Well, we did focus down on these 3 core domains that I mentioned, and we asked people lots of questions, but sort of main topics include things about your OI, which doctors people see, what treatments people receive, how people feel about their healthcare, whether or not they feel clinicians understand their OI or not. We ask questions about OI signs, symptoms, and events and how they impact a person's life and what areas of people's lives are impacted most by their OI, whether that's social, happiness, ability to join in school activities, for example, and which aspects of OI cause people the most worry and concern. From an economic point of view, we looked at direct and indirect healthcare costs. We also looked at coverage of financial needs, and whether or not there are barriers for people obtaining the things that they need in different countries, and also those financial worries and concerns. So to put all of this in context, we also asked a series of demographic questions, so whereabouts people live, who do they live with, their age, their sex, about their OI type, various things like that. And who did we ask? Well, lots of people. We didn't want to just focus down on one particular age group, one particular demographic. We really wanted to understand experiences from across the community. So this diagram gives you a bit of a flavor of how the survey was structured. It was way more complex than this in reality. But we have 12 respondent paths in total, which means, in essence, 12 question sets aimed at different types of people. Eligibility criteria was for those 12 years and above, something which hasn't been done before. And you could answer a series of questions. So there was a set of questions for people with OI, adults aged 18 and above, or adolescents 12 to 17 years, with a slightly modified age-appropriate question set. There was a set of questions for parents or caregiver of one or multiple children with OI, and also a set of questions for people with OI who also had children with OI, so they could answer questions about their own experience and how they felt their children experienced OI as well, and the signs, symptoms, and events. There was a small questionnaire for close relatives of people with OI, so that includes grandparents, friends, siblings, partners, and then also a set of questions for parents of adults with OI, one or multiple grown-up children. So question sets varied depending on respondent type and also the answers given, and they range somewhere from around maybe 15 questions up to 100 plus, depending on the respondents. So hopefully these last 2 slides give you an appreciation of the scale of the survey, and also the breadth of topics that we covered. And then the next step, once the survey was developed, was an extensive pilot testing phase. So we took the survey questions and consulted with clinical experts and members of the OI community who kindly volunteered. And we were testing whether the questions were appropriate. Did they make sense to people? Are we asking the right things? Once we had that nailed down, we had the survey translated from English to 7 additional languages. So that's German, Russian, Spanish, Portuguese, Italian, French, and Dutch. And then we went through another phase of pilot testing. So kind volunteers from across different countries, speaking different languages, reviewed the survey, helped us to understand, are the questions appropriate in a country-specific context, for example. Finally, the survey came to fielding phase, and that was between July and September in 2021. And the recruitment efforts were driven by OIFA and the OIF and a network of volunteers. And they kept up the process for the 3-month period, and we had a series of toolkits, communication toolkits in each language, comprising things like animation clips, email, social media content. We had a landing page, speaker slides, flyers, you name it. And I have to say, all of this effort certainly paid off, because we had responses from people living in 66 countries around the globe. Around 60% of those people were in Europe, around 25% in North America. And then the heat map here just kind of gives you an overview of the general spread of the rest of the responses. Darker colors denoting where most people were, but a really great spread right across the globe. And who are all these people? Well, we received 2,428 completed surveys, and the surveys have been going through a very rigorous data cleaning and coding phase, which is something we have to do before we start looking at analyzing data. As part of that process, 220 questionnaires were excluded, and that's pretty normal. That's things like eligibility criteria not being met, or perhaps we received answers that kind of didn't make any sense from a statistical point of view. But we ended up with 2,208 full survey responses, and that's broken down amongst these different types of people. So we had 1,440 adults with OI. 150 of those were also caregivers.
We had 1 minute left.
Thank you. We had 560 caregivers without OI, 92 adolescents, 12 to 17-year-olds, and 116 close relatives. And on the other side, in pink, you can also see that we had 780 responses by proxy, and that means we've got 780 children, adults, and adolescents, information on those people provided by parents or caregivers. So altogether, information on 3,000 individuals with OI, or 3,000 individuals who have close relations with people with OI. So, quickly, what does all this mean, and why is the impact survey so valuable? To date, it's the largest real-world data set that we have. It has high scientific value and quality, underpinned by the input of experts in the OI community and sheer size and scale of it. We're going to be working through analysing the data over the coming months, and I'm just going to skip quickly in the interest of time to the next slide, just to give you an example of what that looks like. We've got some global analysis planned for this year, looking at the entire cohort. We're just about to publish the first piece, which is an overarching report on the methodology and demographics of the survey, and that's going to be followed by some topical analysis over the coming months. From there, we could cut the data in multiple ways. We could look at country specifics, particular groups, OI types, different question sets. And requests for that data could be granted in future. The data is going to be owned by the organizations OIF, OIFE, and it's going to be managed by a data management committee who will act as custodians for the data. So any requests that come forward for further analysis will only be granted if they're in the best interests of the OI community and the people that have taken part. So just before I hand over to Lena, I'd just like to take the opportunity to say thanks for everyone who's been involved. I know there's probably a lot of people in this room, either as respondents, volunteers, experts. It's been a great experience, flagship project, and without sounding too corny, hopefully makes a great impact. And I'd be very happy to talk more about it, should anyone want to know more. Thanks for listening. Obviously.